Greetings and thank you for joining us today. My name is Wayne Jennings and I'm the host for today's discussion titled Police Reform, Treatment versus Incarceration. We organize these forums as a congregational service to the community to support personal reflection, social action, and to encourage individual and collective growth for all of us here today. I'd now like to introduce the coordinator for today's forum, Jean Martin, a member of our forum committee. She will introduce the topic and our speaker. Jean?
Good morning, and thanks for joining us. Last February, we featured a community forum on community safety, challenges, oversight, and reforms in the Cleveland area. We learned that 9 out of 10 calls for police are for nonviolent encounters. We talked about how communities can diffuse these low-level misdemeanors, keep more people out of jail, and improve race relations. If you missed this forum, it's recorded on our YouTube channel, accessible through our website, uucleveland.org. Shortly after that forum, in May, the Alcohol, Drug, and Mental Health Services Board, or ADAMHS Board of Cuyahoga County, opened a diversion center established to provide an alternative to incarcerations. Recently, the Diversion Center expanded its referral base to include a wider range of public safety agencies, including EMS, including fire and EMS services. Our speaker will tell you more about this. First, I have a few housekeeping notes. After the speaker remarks, there'll be a time for questions and answers. Please use the Q&A box, probably at the bottom of your screen if it's a computer, not the chat box, to pose your questions. If you'd like to receive weekly email notifications of future forums, or if you have ideas for future topics and speakers, send your name and email and ideas to forums@uucleveland.org, or put those ideas or your name and email in the chat box today. I'm pleased to introduce our speaker. Scott Osiecki is the Chief Executive Officer for the Alcohol, Drug Addiction, and Mental Health Services, ADAMHS Board of Cuyahoga County, and was appointed on March 1st, 2018. He has been employed with the board in executive leadership capacities for nearly 26 years. Prior to being selected as the CEO, Scott served as acting CEO and the Chief of External Affairs. As CEO, Scott leads and oversees the staff of the ADAMHS Board and is responsible for advocacy, planning, and management of a recovery-oriented system of care that delivers quality treatment and recovery services through its contract agencies. Scott, the floor is yours.
All right, thank you, Jean. I am going to try to share my screen here, so just hold on a second. Okay. And share. I'm going to start the slideshow here. Everybody can hear me okay?
Good.
Good. All right. It's a little slow. So thank you. Thank you for having me here on this Halloween morning. As Jean said, I'm Scott Osiecki, the CEO of the ADAMHS Board of Cuyahoga County, and I'm going to be talking about the Cuyahoga County Diversion Center and how that works. So first, I just want to say a little bit more about what is the ADAMHS Board, right? Well, we are a quasi-independent part of county government, and we're governed by an 18-member volunteer board of directors. We're responsible for the planning, funding, and monitoring of public mental health and addiction treatment and recovery services delivered to all residents of Cuyahoga County. We don't actually provide direct service, but what we do is we contract with over 70 provider agencies to deliver the services that assist clients on their road to recovery. Under Ohio law, which is Ohio Revised Code 340, the ADAMHS Board is one of 50 boards throughout the state coordinating the public mental health and addiction treatment and recovery system in Ohio. That puts us in a great position to lead new initiatives and to help change how our community responds to people who are struggling with mental illness or substance use disorders. One initiative that we're here to talk about today is the Diversion Center. So why is a diversion center needed? We know that far too many people with substance use and mental health disorders are incarcerated when what they really need is treatment. And we also know that law enforcement officers are often tasked with responding to mental health and addiction-related issues. A large body of evidence and research shows that diversion from the criminal justice system can be beneficial both to the individual involved in an offense and the system itself. Diversion often costs less than incarceration. Diversion avoids the traumatic process of incarceration and the isolation and increase in mental illness symptoms that may result. People who are diverted from the criminal justice system can experience longer-term health benefits, and they could start on their path to recovery much sooner. Cuyahoga County was experiencing issues with the jail that led to several inmate deaths. And based on a study conducted by a consultant hired by the Cuyahoga County executive, 1/3 of inmates had serious mental illness or substance abuse issues and stayed in the jail an average of 77% longer than other inmates. So how was the diversion center started here in Cuyahoga County? Well, advocates have been asking for this for years. The Greater Cleveland congregations, United Pastors in Mission, clients and family members, the prosecutor's office, as well as the county executive and county council. And obviously my organization, the Addams Board, has been advocating for people to be connected to care rather than being sent to jail for many years. The county executive issued an RFP in 2020, and in December of 2020, the Addams Board was awarded a 2-year contract for the development and oversight of a temporary diversion center, as well as expanding our crisis intervention team training to as many law enforcement officers in Cuyahoga County as possible. And then in turn, the Addams Board contracted with Frontline Services to operate a 24-hour police hotline. And that's actually the same hotline as our 24-hour suicide prevention, mental health, and addiction crisis and information and referral hotline that is available to every resident in Cuyahoga County. But we boost the staffing there to make sure that there would always be someone available there and several people available there to answer calls when needed by the police. And that number for everybody is 216-623-6888. And then we also contracted with Oriana House to provide the services that are in the diversion center. So the Diversion Center opened on May 3rd, 2021, and it's the first of its kind in the state of Ohio. We worked very hard with the Ohio Department of Mental Health and Addiction Services to get the facility accredited and licensed and certified to operate as a diversion center. The Diversion Center is exceptional because it allows a person to start on a path to recovery even sooner than a typical diversion program, which takes place after a person has been arrested. So I'm going to take you through the basics of what the Diversion Center is, and then we could talk about how this approach can be continued, part of a continuing culture change that provides support rather than punishment for people and behavioral health conditions. So the Diversion Center, what services are operated in the Diversion Center or offered in the Diversion Center? The first there is observation. There is a special room set aside just for observation of a client when they come in. Maybe the person needs to sober up, maybe the individual needs to be calmed down until they'll be able to have their assessment. And the Diversion Center is staffed by nurses, mental health professionals, psychologists, psychiatrists, as well as other behavioral health specialists. So a complete assessment is done there to see the person's needs, sort of like a triage. You can consider it that way. Then they also provide detoxification service if needed. There's counseling, medication-assisted treatment to get a person started on that for addiction issues, medication stabilization or management to get a person stabilized with their medication. Because we often find that people with mental health issues that are in a crisis, they have been off of their medication for a while. So part of this is stabilization and management as well. And then a really important part of the whole diversion center is linkage or relinkage to community services. We often find that individuals who are in a crisis or brought to the diversion center already have an agency that they're working with. They just need to be relinked back to them for whatever reason. And if they don't have an agency, we will make referrals for them. So that is an important part of the diversion center. And then also there are 50 beds available, and it's available for both men and women. And you have to be 18 years old and older to be a client of the diversion center. So the diversion center opened with the goal to provide law enforcement with a new option to help someone struggling with a mental health or substance abuse issue who was involved in a non-violent, low-level offense. So that was important. This was the founding principle of the diversion center, right? To if when an officer would come across someone who is involved in a low-level nonviolent offense and they're exhibiting signs or symptoms of a mental illness or an addiction, that they would be able to divert them from going to jail to go to the diversion center as well. Instead of jail, right, an individual could be brought to the diversion center for treatment. The primary focus, like I said, is pre-arrest, and that's the goal of avoiding arrest through treatment and support. And when it opened, the facility only took clients directly from law enforcement officers and only took clients who were involved in a low-level, nonviolent offense, but were not arrested for the incident. On October 18th, this a few weeks ago, the center expanded its eligibility criteria to accept referrals from law enforcement, fire, and EMS personnel when they come across an individual that is not involved in a criminal offense, but the officer feels that they would benefit from services at the diversion center. Now, it's also important to remember that the diversion center is a voluntary situation. So even if a person is involved or brought to the diversion center in a low-level, non-violent offense, it is still up to that individual if they wanted to stay for services. Or right at the street with the police officers, they could make the decision to go to jail, or they could make the decision to go to the diversion center. So once again, it is voluntary. And this is the same for folks when they run across somebody. A lot of police, we really listen to the police. We meet with them on a monthly basis, and they told us they know people in their community who are mentally ill or who are living with a substance abuse issue. They know when that person starts to escalate into a crisis situation. They know when that person is perhaps off of their meds. And right now they have some options that they could take the individual to our psychiatric emergency room, but they have to be in a crisis emergency for that. Right? They could also take them to our crisis stabilization unit that the Addams board operates as well, but sometimes that might not be also a good option at the time. So now they have the option of taking the individual to the diversion center. So the eligibility, that's kind of like a news alert for you all here, is that tomorrow it's going to expand again. That's Monday, November 1st, and that's going to include referrals from family, friends, and individuals themselves. So the process is still going to be the same way though. The concerned person must call the helpline at the 216-623-688. So whether that's the family, friend, individual, or police, and then the helpline can determine if the diversion center is the best option for individuals or another resource. So how does a person become involved or become a client of the diversion center? So first of all, right, you have to be 18 years or older because this is for adults only. So the officer or a public safety worker encounters an individual who may be struggling with a mental health or substance abuse issue. It was non-violent, right? It has to be non-violent and interested in voluntary behavioral health treatment. The officer or public safety personnel or now an individual will call Frontline at 216-623-6888 for a screening. So at the other end of that line, there are mental health professionals there, and they are able to help the officer, help the individual conduct a screening to see if the individual is eligible to go to the diversion center. So if the individual meets the criteria, Frontline will call ahead to the diversion center to let them know that the police or a family member or a friend or the individual themselves will be going to the diversion center. Let's say if a person wasn't a good candidate for the diversion center, that Frontline advises them on other options. I mentioned those before. Our psychiatric emergency department, which is at St. Vincent Charity Hospital, they could be taken to the nearest emergency room, or our crisis stabilization unit, which is also run by Frontline. And also, if needed, depending on the situation, Frontline may respond with a mobile crisis team and actually go out to that situation. The process can start the individual's connection or reconnection to treatment and recovery without the trauma of being involved in the justice system. And it also gives officers a better option for people who are struggling with a mental illness or a substance use disorder. So now I'm going to switch screens here, and I'm going to play the YouTube video that explains what the diversion center is. So, you'll see that it includes the information about the person needing to have the low-level offense, which is still relevant, but we're in the process of updating the video, but I will show you what we have now. So let me get to this. I will make the screen big. Right, you could all see that. Okay, and I will hit.
No, we're not on the right screen. Scott.
Oh, you can't see that screen? Again, okay.
We
Sorry.
see the link.
I'm sorry.
We see the link.
Okay, so I have to stop the share and then share again. Remember, like I did last time. Okay, sorry about that. And share. Okay, can you see that one now, a different one?
Yes.
Okay.
County partnered with the Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County, also known as the Addams Board, in opening the first pre-arrest diversion center of its kind in Ohio. The Cuyahoga County Diversion Center has been developed specifically as a tool for both law enforcement officers and the people with whom they interact. Officers now have a better option than jail when they encounter an individual that discloses or exhibits signs of a mental illness or substance abuse issue, who's been involved in a low-level, nonviolent offense that could result in arrest. We know that too many people living with substance use and mental health disorders are incarcerated when what they really need is treatment. And we also know that law enforcement officers often respond to mental health or substance use-related incidents that involve a low-level offense. The Cuyahoga County Diversion Center provides that alternative to incarceration for people living with mental illness or addiction who have an interaction with law enforcement regarding a low-level, nonviolent offense.
Jails are not the best place for individuals living with mental illness and substance use disorders. 1/3 of the inmates booked into the Cuyahoga County Jail were living with a mental illness or substance abuse issue, and we have found that they stayed in the jail an average of 77% longer than others. Of course, some people do need to go to jail. We are not disputing that. But just like we have alternatives, if an officer encounters someone who is in a deep psychiatric crisis, we need alternatives for someone who is engaging in low-level activity and are struggling with mental illness or substance use. They need help, not jail. Our officers want to get them the treatment and support that they need and deserve.
The Cuyahoga County Diversion Center does not replace any of the existing crisis response resources or options. It is just one more tool for officers to use in situations where individuals are involved in a low-level offense and are struggling with a mental illness or substance use issue. Here's how it works.
As a law enforcement officer, you encounter different situations every day and must make decisions. You make the call. Here's a situation that might make you decide that a trip to the Cuyahoga County Diversion Center would be a better option than a trip to jail. You encounter an individual involved in a low-level offense that could lead to arrest. As you interact, you realize that the individual might be struggling with a mental health or substance use issue. They are not in a crisis. They do not seem to need immediate hospitalization or any high-level interventions, but they are exhibiting a behavioral health condition. So what's your call? Well, fortunately, you have an actual number to call. The police helpline at 216-623-6888. This is the 24/7 hotline operated by Frontline Services. You have probably called them for other mental health related encounters. They are also now your first contact when you think someone might be eligible for the diversion center. If the person you want to help is an adult involved in a low-level offense and seems to be living with a behavioral health concern, then call the police helpline at 216-623-6888. When you call, you will get a brief recorded message. Don't hang up. A mental health professional will join you on the line. They will ask for the following: your name, badge number, and your community or district. the name and date of birth of the individual in question, a brief description of why you were called to the scene, and a brief description of your observations and understanding of what is going on with the individual. They will provide a brief screening over the phone to assess if the diversion center is the right option. If there's a different option that fits your situation, or if the diversion center is full, then frontline staff will provide those alternatives. The Cuyahoga County Diversion Center is a voluntary option for the person you encounter. It is not a lockdown facility or appropriate for people who need a high level of crisis intervention. You still have all of your existing crisis resources for those situations. But this can be a good option for both you as the law enforcement on the scene and the person who is facing arrest to connect care rather than jail. Remember, once you make the call that the diversion center might be the best option for the situation, then actually make a call to 216-623-6888. You connected with the police helpline, receive screening, and were advised to go to the diversion center. Frontline will let the diversion center staff know that you are bringing an individual. The Cuyahoga County Diversion Center is operated by Oriana House and is located at 1804 East 55th Street in Cleveland. It is open 24/7, so it's available whenever you need it. The drop-off process is designed to be quick because we want you to be able to get back out on patrol or back to your duties without much disruption. You will need to transport the individual to the diversion center and walk them into the building. Sign in, talk to the staff on duty, sign out. The goal is 10 minutes or less for drop-off. You will be leaving the individual in good hands. You can think of the diversion center as a triage area. During their stay at the diversion center, the individual will receive behavioral health care. Services can include observation, detox, medication-assisted treatment, and wraparound services. Plus, the diversion center staff can help the person get connected or reconnected to longer-term care in the community. Remember, this is a voluntary facility, but the staff is very well trained in engaging clients in care. Diversion center staff will provide feedback to your police department's designated contact regarding the individual's stay.
As we said, this is the first diversion center of its kind in Ohio because of its close connection with law enforcement. As of now, the Cuyahoga County Diversion Center only takes clients directly from law enforcement and only takes people who are at risk for arrest for a low-level, nonviolent offense. It does not take people who are already charged and booked into jail. The goal is that a person can avoid arrest and jail by connecting to treatment and support instead. Law enforcement officers have been part of developing this project and are key to its success. You can find answers to frequently asked questions from police officers at adamhscc.org/diversion center.
I want you all to know that I have 34 years of law enforcement experience, and that over that time, the requirements that have been placed on law enforcement officers have increased exponentially as to what the community expects us to do. However, I want you to be very comfortable in the fact that with all of these new options that are available to us, they are allowing you to exercise good judgment and to actually help the people that we're sworn to serve and protect. We are proud as law enforcement professionals to have partnered not only with the 59 plus different law enforcement agencies in the county, but also with the Addams board and the many aftercare and healthcare providers who have committed themselves to success in this program. And we look forward to successful resolutions for people as we move forward.
Okay, so I'm going to stop that one, and I'm going to show you another one so I don't have to switch back and forth. But what I'm going to show you next is a video from RTA, something that they helped out within the diversion center. So let me stop this one. And I will show you this one.
For my tour, I looked out this side because this is the side for the ladies to kind of have an outside space. And when we came and looked at it, it was just full of overgrowth. So the second I looked at it, I said, we can do something about this. I know we can. So I talked to a lot of my officers at RTA, And it just kind of snowballed into this big process. So now, if you take a look around, we have people from all over RTA helping us out here. We're planting some flowers. We're gonna put some park benches out here, some picnic tables, and we're gonna beautify this area so that the diversion.
Sorry, it's not running very well.
By this area so that the diversion center lady.
You ever
Oh,
wondered
sorry.
what
That's not right.
actresses do when they have to get in shape really movie? Because I can promise
Sorry,
you,
that didn't work out. Gonna stop the share. Well, what that video was, sorry about that, everybody. What that video was a video from the RTA, and they made a they made a video. They spruced up the garden area there. So I'm gonna go back and stop the share. Technical things work when they're great, right? But when they don't, it's not too good. Okay, so I'm gonna share the screen again. Point. All right. We'll start this back up again in 1 second. The internet.
sub 10% body fat year
I
round.
don't know why it's still.
Well,
saying
you could
this.
say, well, I have a couple injuries and I can't lift heavy. You don't have to lift heavy to get in shape. You can say,
Sorry, that was the next YouTube that was gonna play. Why is this? Why is this not going? There it goes. Okay, so this was, can everybody hear me now still? Can you hear me, Wayne?
Yes.
Okay, all right, so our law enforcement partners, right, and we're saying that we really value our partnership with law enforcement. And actually to date, as of October 22nd, we've had 84 clients brought to the diversion center, and Cleveland Police and RTA Police are the largest referral sources. And then once again, that RTA contribute that women's garden. So we have about, I think it's 20 law enforcement departments that have participated in dropping off clients. So we know there's some issues, right? So Cleveland issues, just like, obviously implementing culture change isn't easy. And just like other communities around the country that implement a diversion center, there've been a few bumps in the road, right? And it takes time for people to get used to something new in the community. In fact, somebody shared with us an article about the diversion center in New York, and the cost of the diversion center there was $100 million to develop it. And they have 2 of them, and only one of them has served 45 people, and the other one isn't open yet. So, you may have seen a couple front page articles in the Plain Dealer and a Channel 19 story about Cleveland's slow use of the diversion center. And it's even made it into the mayoral debates for Cleveland, sponsored by the Greater Cleveland congregations. So the city of Cleveland has been slow to issue what was called a divisional notice to their police officers, and that gives them official permission to use the center. Now, Cleveland's been using it all along because they've learned about it and they know about it, but there was no official police order for that. The bad news is, right, that the city, so the good news was that recently on October 13th, the city of Cleveland did issue their police order for the divisional notice for the diversion center. The bad news is that the city added extra steps to the process, which is not required by any other police force in the country when using the diversion center. What they're requiring is that prior to being taken to the diversion center, that an officer must contact the city prosecutor's office, as well as the hotline number. And something else that they added in there was that the victim needed to actually approve the person going to the diversion center. And they were stating Marcy's law on that. So, Marcy's law says that a victim of a crime has rights, to go through the process, the court process, and know things that are going on. But the key to that is that the Marcy's law is for victims of violent crimes, right? So we're talking about the diversion center, even if there is a crime committed, right? It's non-violent. So there really per se isn't a victim in that sense that there's a violent crime was committed. Let's say a person broke into a car or, broke a store window or whatever, there's still a police report made so that person could contact their insurance company to remedy that situation. But a victim, in that situation or any situation certainly shouldn't be dictating if a person is allowed to go to the diversion center. So that was quite an issue. So other good news was that just last Friday, October 29th, Cleveland Police said they're going to rescind the policy requiring the crime victim's consent to take people to the diversion center. So that's good news. But kind of different kind of news is that they're still going to be requiring the officers to call the city prosecutor's office first. They want to keep that in there. But in the mayoral debates, both candidates said that they would look at that and they would consider, or they would remove that requirement from use of the diversion center, because they are both in favor of treatment instead of incarceration. So I want to talk a little bit about the CIT expansion portion. So in our contract with the county, they wanted us to expand crisis intervention team training to as many of the police officers in Cuyahoga County as possible. The county was very set on having all officers trained in CIT. So for decades now, the Addams board has providing CIT, or crisis intervention team training, to officers. And the purpose is to help them intervene successfully and safely with someone who's experienced mental illness or a substance abuse issue or symptoms. And as part of the diversion center contract, we've actually adapted the CIT training model and to reach more officers all across the country. So the county. So with the trainings that what we do is we're offering 2 40-hour trainings each month. So that is where officers receive the full CIT training, and in there is training about the diversion center. Then also we offer 1 8-hour refresher course for police officers who've already been trained in CIT who just want a refresher course. And we also a 1 8-hour dispatch training for dispatchers. So you can see our training department is very busy training individuals, police officers, law enforcement officers in the crisis intervention team training. So as of just Friday, we have trained 684 participants. And that was from 52 law enforcement departments. And just wanted to point out that 17 of the 65 Shaker Heights officers trained. There's 65 officers in Shaker, 17 of them have been trained, and I know there's more to be signed up. So because the Addams board, we believe in CIT training so much, and we also once again listened to law enforcement, and they said there's a cost for an officer to sit in training, especially a full week-long training where they have to have somebody else cover that individual shift, and there's just other costs associated with that. So what we're doing is the Addams board is paying $150 per day per officer who complete the training. And that $150 per day per officer goes back to the law enforcement department to help defray some of the costs they have. And some are also putting that money into different training opportunities within their department. Data. So want to talk about data. So once again, just want to remind everybody that we have a 2-year contract with the county for the diversion center. And it's considered like a pilot project. And Cuyahoga County is in the process of planning for a more permanent location. But right now we're involved in this, and it is that contract ends on December 31st, 2022. The county is in the process, I said, for looking for a permanent location, and they've contracted with a design build architect, and they were looking at 3 different locations throughout the county as to see where they perhaps could put a more permanent location. So being that this is like a pilot program, that we have various data collection points that we monitor and look at, and we share those with the county. And that is about 50 metrics, 50 points that we're looking at. We're looking at the number of calls to police hotline and how those turn out, number of client drop-offs, number of admissions, and number of discharges, the length of stay that a person would stay at the diversion center. We're looking at all the client different demographics demographics, their age, their race, their sex, their location. Are they homeless? Do they have a house? Are they working? Are they educated? Do they have a college education? Do they have a high school education? We're looking at all of those different demographics. Then one is type of treatment that's provided there. Earlier I shared the different types of treatments that are available, so we're monitoring that as well. And then the referral at the end, where are the clients being referred to? Then we're also looking to see have any clients returned back to the diversion center following up. And actually that's also a good indicator if the diversion center is working, and actually it is. I mean, we had one individual who had to be returned to the diversion center, but everyone else who has went through has went on to treatment in the community, or they haven't had any interactions with law enforcement. And then we're also monitoring the CIT program. We're doing officer satisfactions with that. How many officers have went through it? So we really have been monitoring this. Also want to mention that the county itself created a diversion board, and that diversion board has various individuals. It is chaired by the CEO of Metro Health, and there's other individuals on there who have experience with law enforcement. Chief Calvin Williams is on there as well, and several other people. So they're looking at the diversion center with us. So we participate in those meetings and share all that information with them. So kind of just wanted to do a wrap up, right? So, the diversion center really is a welcome addition for our community. It's part of our continuous crisis continuum. So it's part of that. And people who are going to be utilizing the diversion center, or who are, and really can stabilize much faster while they're there, and then be connected to longer term care through our network of agencies. And so I appreciate you asking me here today, and I hope they could count on all of you among the advocates who speak up for people who are struggling with mental illness or addiction, as they need our care, not incarceration. So I want to thank everybody for that, and I'm going to unshare my screen. Sorry about the little mishap with the YouTube. It's always, you can practice it all you want, but it still doesn't work out. So, all right, I'll turn it back over to Jean, I think, or Wayne.
To me. Thanks, Scott, for an excellent presentation. It's really great to know what treatment opportunities are available for people who need it. I also want to mention that when we were planning this program, we invited both the Cleveland prosecutor, Akila Jordan, and Deidre Jones, the RTA police chief, who you saw in that video. And I've seen that video and it's pretty terrific. They both were not able to make it. It's now time for questions and answers. We're using two ways of handling questions. If you use the Q&A button, you can choose to include your name, and we'll use it to recognize you by name, or you may choose anonymous. You can also use the raised hand option, and we'll call on you to speak verbally. So figure out how to unmute yourself, and you can do it that way. I'll now turn this over to Debbie Wright and Laura Imbornoni, who are members of our forum committee and co-chairs of the Q&A session.
We didn't decide who goes first. Laura, why don't you go first?
I'm very ready. And it was so interesting, Scott, to hear you talk about this. And a lot of questions have come up that are very interesting. I'm sure we'll hear more with the raised hand option that you'll hear spontaneously. So one question we have is, if the prosecutor's office was instrumental in beginning the diversion center, why are these barriers being created that, as best I can tell, are not present in the similar situations in other cities? That would bring up another question, which is very related. Why do you think City Prosecutor Jordan wants her office notified? I'm thinking she must have a reason for that, right? And so there must be a good reason for that. Actually, I've read a couple articles, I haven't quite seen that. And then in what way does notifying Jordan's office block the admission of people to the diversion center?
All right, so it was a three-part question, right? So the
Yeah.
first, in the development of the diversion center, it was the Cuyahoga County Prosecutor's Office that was involved in it.
Okay.
So then they had conversations with the Cleveland prosecutor. So there's two different prosecuting things involved in here, their offices.
So it was the county that was involved in implementing it. And so the city then was not a part of that. And the city has sort of had this thrust on them, so to speak, or?
But the city of Cleveland police were involved in this,
Okay.
all of the discussions and going forward. So the city was involved and the prosecutor was involved, but these were just, it was just something they didn't see eye to eye on, right?
Understood.
The second question was why, right? Why does she think that it's important? In conversations, in one conversation I had with her, with other folks, is she was talking about that Marcy's Law. So Marcy's Law was originally designed, right, for victims of violent crimes, right? And she was relating that to this. That was her reason. She thought that the victim should play a part in this, so they should know if somebody that committed a crime against them was going to the diversion center. So that's where that part that came in about her saying that the victim has to approve it. So we know that was taken care of. So the other part was about calling her office, right? So she wanted to make sure that an individual who was being brought to the diversion center, let's say that they weren't involved in a high level offense, right? Like if there was a warrant out there for murder or for rape or anything like that. But the thing is, when a police officer comes across somebody, right, the police officers always run a check on someone, right? So like if you get stopped, for a ticket or whatever, right, they run that check and then they know who the individual is. So, and then throughout the country, no one else has that provision within how the law enforcement uses the diversion center. So it just goes against that.
Well, isn't there an issue of hours too? I mean, the prosecutor's office is open Monday to Friday till 8 o'clock at night, and then 8 to 12 on Saturday, and not at all on Sunday. And when do a lot of your admissions take place? Saturday night?
Yeah, actually, I think it was Sunday afternoon, I think, was the highest admission time.
Yeah, well, there you go. Yeah, but they're not open then. So what do you do? Yeah.
What they decided to do is that they would have a prosecutor available 24 hours a day, kind of on call, is what they were going to do to solve that issue. So, but it's just another step also, right? So remember, this is voluntary too for the person to go to the diversion center. So first the officer would have to call frontline, or who calls first? Where do they call first? The prosecutor's office or the diversion hotline, right? So it kind of just adds more time into that as well. But also the police would know when they're running the check and they're running the person name, they would know if that person was involved or wanted, and they certainly wouldn't be going to the diversion center.
Right. Well, how long is the average stay at the diversion center? I mean, how many empty beds do you have at a time?
Yes, so it's a 50-bed facility, right? So
Single occupancy?
No, they're sort of like a dormitory style. So
okay, double occupancy, 3 beds.
I'm sorry.
2-3 beds in a room.
Yeah, they're not really a room because they're like half walls. So the person, like the nurses and stuff, when they walk down the halls and things, they could see what's going on.
No privacy. Gotcha. Okay.
Yeah, but we have to monitor, right? And they thought it was really important that you monitor what's going on there, right? For the client's safety and the safety of other clients as well. So a person could stay at the diversion center from like up to 5 to 7 days. That's how it's designed, because if a person's there in detox, right, that takes 5 days right there, and then to get stabilized. So the diversion center, somebody could stay there from a matter of hours up until that amount of time, right? So the average right now is about 1 day or 2 days that an individual is staying there. And that's based on what sort of treatment that the person actually needs to get rehooked back up to services. So we have the capacity for 50, right? But the diversion center has not reached that capacity level of all. I think the most they've had is 2 or 3 people in the unit at one time.
Can I just clarify voluntary admission? People in crisis don't want help, often refuse help the first time they're asked if they want help. And sometimes once they get help, they're really glad they got that help. So, how voluntary is the voluntary, or how
Yeah.
persuasive, or who does that persuasion to get them to go there rather than jail or released on the street?
Yep. So the police play an important role in that, in swaying the individual, whether they want to go to jail or they want to go to the diversion center. The person on the other line, on front lines, and also that they could actually talk to the person as well. Also, when it comes down to it, right, if a person say, I'm going to take you to jail or the diversion center, it's their option, right? So when they get to the diversion center, right, it's Oriana staff. They try to work with the individual to let them know, hey, this is what, stay here for a little bit so we can solve this, or we could work this out and see if this is good for you, right? And what kind of treatment, to let them do the assessment. But oftentimes the individual may decide, oh no, I don't want any part of this, just like you say, and they leave.
Mhm.
Lori asks, what role does the advisory board play? Do they do more than review data? Who receives whatever recommendations they have? Are the meetings and recommendations public record?
Yes, they post their minute. Well, the meeting is public and it's on the Cuyahoga County website. When you look under boards and commissions, it's there. They are responsible for, I don't know, that's an interesting question, right? So they've only had 2 meetings so far. The first meeting was setting up their bylaws and things like that. The second meeting was they were reviewing more of the data. We reviewed data the first meeting. The second meeting I wasn't available to come, but they reviewed data there. And that's when they were also making a recommendation to open the diversion center to beyond just individuals involved in a low-level nonviolent offense. So it's kind of yet to be seen. What will the diversion center board be doing with this? I know that they'll also be playing a role in the selection or decision to move forward with a permanent site.
One other question that Lori had was, what is the status of the 3-digit hotline number? Because I know I looked at your number and it's too long for me to remember.
Oh, yeah. Oh, so 988, right? So 988 was supposed to go into effect in January, but now it's not going into effect until July 1st. And that's a national number, right? 988. So there was a story just the other day, right, that we all have to make sure we dial the prefix before we make our phone calls. And I know that went into effect with the cell phone numbers and things to avoid the confusion. So Frontline Service is actually a part of the National Suicide Prevention Hotline, and it's already been selected as one of the 988 operators. So there's a lot of questions with 988, right? I'm not on the committee for that, but Frontline is on that with the state, and everybody throughout the whole state has interesting questions about 988. But the 216-623-68 number will still work, and the 988 number will also work. It'll go to the same place in our area.
Pat is asking, does the diversion center provide any aftercare, or is it all provided by referral to community agencies? Another person was making note that the North Star Center is sort of in the proximity, and wondered if clients have the ability to utilize that while they're at the diversion center.
At North Star, right, is operated by Oriana, and it's right next to it. But they're 2 totally separate, complete programs. And the whole purpose of the diversion center is to stabilize somebody and link them or relink them to services in the community. So there's no aftercare provided.
Mm-hmm. Thank you.
Lori Albright was also asking, what is the police experience with the drop-off? Is it really just taking 10 minutes, or is there a lot more paperwork and time involved off duty?
No, we're finding it's actually taking less than the 10 minutes. So the police officers who are dropping off are very, very pleased with it working out. I mean, like I said, we have 20 some police departments that are using it. Shaker Heights uses it. Westlake uses it. So it's a lot of the community is using it, and they're doing police surveys as well with the satisfaction. And I don't think we've had those yet, but all the interaction we've had with the police, and also with the how we meet with them monthly, that they're in favor of the diversion center, and it's helped them a lot.
I want to mention that we still have really good questions in Q&A, but you can also raise your hand and actually get into more of a dialogue with Scott yourself. So if you raise your hand, you'll be recognized and you can ask a spontaneous question. We have a question from Jim. How many of those who go through the diversion center are able to gain employment? How do people do after they go through the diversion center? Is there, you were just saying there's not follow-up because you're referring them to other agencies, but do you guys get to find out how well the treatment worked for them at the diversion center?
Yeah, as of now, I don't know. We've only been open since May.
Oh, yeah.
Yeah, so it hasn't been a long time to follow up and do tracking. But part of the metrics that we will be looking at, right? So when we have the information of the client there, right, and then we could match those folks in our database, right? If they've been involved in our system and services that the Addams Board would pay for, and that would definitely be employment services. So we would be able to sort of do a search on those individuals to see. So that's something follow up in the long run that we hope to do.
But this avoids them having a court record or a conviction or an arrest record someplace. So it should help a little bit.
It should help, yes.
Yeah. An anonymous,
Also, go ahead, Debbie.
an anonymous question asks, where did the funding come from for the diversion center? Who decides how much we'll get in future years, especially with the need to have a permanent location and all that?
Yep. We've been told that the county executive and county council are using the opiate settlement dollars for this. Right now, it's a total of 9.8 million for 2 years. So it's about 4.5 or 4 point some million dollars each year for operating the diversion center. And so that is where the funding is coming from.
Bonnie asks, will the center expand to assist with empowering pretrial citizens and giving them support? And if that's the case, when will that happen? Will that be part of what the center does, Scott?
No. So right, it's yeah, just now, right? So it's pre-arrest, right? So it's before a person would ever be in front of a judge. Right. So I know that also that the county is thinking of expanding this as well to central booking. Right. So when a person would be picked up and brought to the jail, they are working on central booking. So before they're actually booked, they may be referred to the diversion center. I don't know, I just kind of thought that was related, but yeah.
Yeah. Well, so then do quite a few people go on to jail after they're in the diversion center? And
oh, yeah, we don't know that. No, but the thing is that you're diverted from the crime that you supposedly committed, right? So there is no record, there is no charge against you. Now, if they committed another crime after they left, and they could be charged that way. So yeah, but the whole purpose is to avoid the judicial system altogether.
Thank you. These questions are really fleshing things out for us.
An anonymous question asks about the diversion center for people under 18. Are there plans for developing that type of program also?
Well, that's an interesting question. So there are children's advocates. So maybe not a diversion center, but sort of talks about a children's crisis center or services, right? We are involved in various discussions with the heads of all the different human services departments and with DCFS. As you know, that DCFS often has kids that end up staying in their building and they need to find a place for them to be. So we're all kind of looking at that. It might just be developing more foster care parents, but other advocates, community advocates, are looking for a place where kids could go in crisis. So not necessarily diversion from a crime, but crisis. But that's something down the road, and of course would need a lot of funding as well for that, and a lot of things to work out. We're at tape wise in trying to work that out.
Someone asked about plans for a second diversion center. As you're making plans for a permanent location, would be better to have two because of the size of the county to be more easily people, shorter distance for police to take their people to?
Well, that's a good question. I think that's more of a question for the county executive and his staff, because they're leading that charge for having a larger diversion center, a more permanent location. And I really don't have any more information on that. But actually, the East 55th Street, we haven't had any complaints that it's too far from the officers, right? Because it's off of the highway there, and it's even off of 90 and Chester and getting there. So yeah, we don't think it's that. We don't think that East 55th is too far for someone to bring on.
Do you have any issues with getting qualified staff? These are difficult people to work with. It requires a lot of clinical knowledge to be able to tell the difference between different types of addiction and mental health issues. And how do you know, who does these evaluations?
Yes,
Complicated.
the whole behavioral health community, every one of our provider agencies is having a problem with staffing, right? Just like with restaurants and everything else. And the behavioral health field has been underfunded for so many years, right? And we have social workers coming out with master's degree and over $100,000 in debt. And a person could go to Aldi's, or they could go to even an ice cream store or Walmart and make more money than they're making right now for a very, very stressful job. So our Applewood and our Belfair, we provided additional funding to them to boost their salaries, because the children's residential system was really, really understaffed. So we're working with them to try to boost their staffing. But it's the same is true at the diversion center, right? It's a stressful job, or will be a stressful job once it reaches especially full capacity. And we really have to find a way to attract people into the behavioral health workforce. And even the Addams board, we partner with the Cleveland Municipal School District. I can't remember the exact program, but we're creating videos for grade school, elementary school, and high school, portraying different careers that could be in the behavioral health field to once again create the interest in it. We're looking at scholarship programs. We're looking at paid internships. So we are looking, and this is also throughout the whole state as well, looking at different things to boost the behavioral health workforce.
Speaking of schools, it was noted by one of our participants that there are quite a few students who are 18 years old in high schools. Do high schools refer to the diversion center? Has that happened?
No, that hasn't happened yet, right? But it's kind of friends and family referral, kind of like, well, when that starts on tomorrow. So we'll kind of see, but that is an interesting point, because right, there are 18-year-olds in school as well. So that is something we'll have to look at. Good comment.
For those of us in the community who feel very positive and supportive, are there ways that the community can support this Beginning Diversion Center? One person asked, can regular citizens volunteer in any way at the diversion center?
As of now, no, because like we're saying, because of HIPAA regulations and Ohio Revised Code regulations. But I can tell you this, though, that NAMI Greater Cleveland, right, they are offering 3 sets of programs there about, dealing with mental illness, dealing with your substance abuse and things like that. So they have volunteers, but the volunteers had to go through a rigorous FBI background check in order to work at the diversion center. But we have a contract with them as a provider agency. So they're not regular citizens, but I know regular citizens, I know they can donate clothing and books and games and things like that. And you could certainly contact the Addams board, and we could help you with that. But as right now, I say regular citizens, right, can't really volunteer there.
I wanted to mention once more, look for the raised hand option on your screen. If you'd like to ask a question directly, look for the raised hand option. And Debbie, I bet, has another question.
Will the diversion center also take people who've already been in charge or currently in jail? I think you said not currently in jail. Is that correct?
Yes, not currently in jail, no, or like already charged with something, but let's say they were already charged with something and they served their time in jail, and then there was an interaction again, a different kind of interaction, low level, nonviolent, or like involved in not a crime at all. Yes, they are eligible to come to the diversion center.
How about if they're under bail for charges that are still currently against them? Are those kind of people weeded out, or?
That's sort of an interesting question.
Because a lot of people are chronic repeaters,
Yeah,
like,
and
you're at the grocery store, you're shoplifting, you're having altercation with the people at the store, you've done this in the past. Could you go to diversion center now, or would you say, no, that person has to go to jail?
Yeah, I can't answer that question. That's a really good question that hasn't come up before, but we'll definitely, we'll follow up on that with the diversion center. But I mean, they're out on bail, right? And they're not being picked up for the same crime, right? Or
Similar crime, but different crime, but right. It's just a question about, especially as we're looking towards eliminating cash bail or having more people out in the street who have current charges against them.
yeah,
And we need to kind of think about, I guess, what we're going to do with those people, because
yeah.
they still have whatever emotional issues they have.
Oh, definitely. Yeah. Yeah. I will jot that down, and that's a good point.
And which counties or communities are not using this? Is there some glaring examples of people who say, we're not going to take people here?
No one has said they're not going to take people there.
Mhm.
So I don't have the list in front of me, so I can't
Yeah.
really point
I'm
out.
just curious. Did we hear Shaker Heights? You mentioned them just because we're in Shaker Heights? Or?
Yeah, that they're using it, right? Just because, exactly. Thought it would be
Okay.
an interesting point. But then also, Shaker, Westlake, Bay Village, you know what I mean? So it's not all right. People always have this what do I say, a stigma against people, right? That think that people with mental illness or drug addiction or whatever are like in poor neighborhoods, but that's not true, right? I'm just saying that the county, when you look at all the people we serve, every single city has issues with mental illness and addiction. It doesn't discriminate.
And I guess I sort of had a question about the point of contact. So it is an active police officer. Now, years ago, my husband worked as a crisis intervention worker where he went out with the police officer. So that they had a crisis intervention worker on the scene assessing, does this person need jail? Does this person need crisis intervention? And it's a lot for the officer, given their training level, to make these decisions.
Yeah, it's a lot, but police officers make decisions every day,
Oh,
right?
yeah.
Every single day about what they're going to do. So that's why that 623-688 number is important, because that is helping that individual make that decision. And you mentioned co-responder teams. We have a program with the city of Cleveland. In every single district, there's co-responder teams. We're also looking at for 2022 the development of care responder teams, and that's what is developed in New York with Fountain House, and we're working in coordination with Magnolia Clubhouse to try to do a pilot program here. So that would be, the police wouldn't be involved at all, right? It would be a person with lived experience as well as a professional going out to de-escalate the situation or see. And of course, with friends and families, that the care responder team would be able, of course, to refer to the diversion center, as long as they do that 623-688, because it's important to point out that calling that number is that's the entry point, right? You have to have that screening first.
And there's one last question in this list here about what types of spiritual help are offered at the diversion center. Is that something you stay away from?
I'm sorry, you broke up.
What type of spiritual help is offered at the diversion center?
I know that we've talked about spirituality. We hope, like through the NAMI programs, that a little that would be reached, that they talk about spirituality in there. But right now we don't have a particular faith-based program in there right now. That could be something, of course, that could be expanded as we continue to grow the program.
Kind of a hot button issue, though. How about with COVID? How is COVID affecting you with masking and distancing and vaccines and all that sort of stuff?
Right now, since it hasn't been at full capacity, it hasn't been an issue at all. Yeah.
Lori has a follow-up question concerning the advisory board. She asks, who or what entity would respond to any recommendations the advisory board formulates? They're community meetings, and I know that the two that I've been through, or one that I've been through, that there have been community advocates there, and anybody, and they have a way of reaching out, I believe, on the county website, but I'm not sure. But it would be Brandy Carney over at the county. She's on that diversion board, and she is also working with us closely on the diversion center. So any recommendations to or from the diversion board, I think would actually go through her, and I know her contact's on the website there. And then also, if somebody has an opinion or they want to make a recommendation to us, we could certainly do that and bring that to the diversion board. We're constantly talking about the diversion center. There isn't a day that goes by that we're not talking about it, and in partnership with our partners. with that in mind, the local articles have focused so much on the whole controversy about, the need to report to the prosecutor's office before someone's admitted, the focus has been there. And from those articles, one can see that there are a number of diversion centers in the United States that have been up and running for a longer time. So with all that in mind, what do you see for the future? Once police are able to directly admit people, and then maybe there's other things that we have to look forward to as this diversion center gets on its feet.
Yes, I think we could really look forward to, right, having providing services as quick as possible to individuals in crisis, right? So, we're calling it a diversion center. We're diverting from further escalating crisis for an individual. We're diverting from hospitalization of an individual. We can get them stabilized at the diversion center. So what we're really looking forward to, right, is having our community have quick access to behavioral health services that they need. And, this whole step of how quickly we're opening it to the community, to family and friends and the person themselves. I think that's a big step that we're taking forward. But the primary thing will always be that the pre-arrest to divert from the criminal justice system. But like I said, we could really look forward to, just like those other communities did, right? That it just becomes a regular part of the community to help individuals in need.
Are there any last questions you have, Debbie?
No, but I just wanted to clarify, when you say the community can refer people, is it still going to be police transport, or would individuals transport the people there?
Right. Well, that's something we're working through, right? But the diversion center doesn't provide transportation to the diversion center. So let's say a person is at the diversion center and we will make referrals. Let's say it was a referral to an agency and they had an appointment, then there is a transportation service that will take there. But there's no, if a person's in a crisis, there's no transport to the diversion center.
Right. But right now it's only police can transport, but then an individual could transport themselves or the family member.
Right, family or friends, right? But once again, they got to call that hotline number for the screening. So
they just show up at your door, huh?
What's that?
Don't show up at my door, call first.
Exactly, because it's not set up to work that way. And you can see why too, right? Because the diversion center has to understand what is happening with the individual who comes in, and that a person may be better suited for the psychiatric emergency room as well. So that's why the whole screening process.
Scott, before we turn our forum back over to Jean Martin, is there anything else you would like to say about the Diversion Center for us today?
Yeah.
Any final words for this?
Just thank you for your support with this. I thought this forum, I thought it was really great, and the questions are fantastic from the folks. So just ask for continued support from individuals. I see there was a question.
Late breaking one about suicide. Yeah, suicide ideation.
Yeah, would a person threatening suicide be eligible? Well, that would all depend on when they call that number, right? Because that's our suicide prevention hotline as well. So they talk with the individual and they what I want to say, assess the threat. So that one might be more appropriate for the psychiatric emergency department if someone is actually in the throes of, considering suicide.
The hotline will help make that decision. Well, that's good.
Yeah.
Thank you so much.
Thank you.
And thank you.
Jane?
So thank you again, Scott, and our questioners for an excellent forum on the Cuyahoga County Diversion Center. It's such an impressive program, and I love that your outreach is so vast. Next week's forum will directly follow elections, and it's titled Frank Talk on Political Parties, Polarization, and the Future. It will feature Jonathan Enton, a case law and political science professor, in conversation with Ryan Clayson, a Kent State political science professor. This forum has been recorded, and it will soon be available on our congregation website, uucleveland.org, in the forums section. We invite all of you to join our service at 11 this morning. Today's topic will focus on the legacy of our ancestors. We're meeting inside in our sanctuary where seating is marked for social distancing, and masks are required. The congregation's location is Shaker Boulevard at Belvoir Oval in Shaker Heights. If you can't join today's service inside, you can go to our website, uucleveland.org at 11 and click on the YouTube icon. You can also go to our Facebook page, which is Unitarian Universalist Congregation of Cleveland. We appreciate your continued support and look forward to seeing you next Sunday morning on Zoom at 9:30 for our forum on politics. Have a great Halloween and go Browns.
Thank you. Bye.